The University of Oklahoma Foundation and the University of Oklahoma have benefited enormously from the generosity of all of our donors. And when you look at the total number of chairs that have been established by foundations in support of our health sciences, it's more than 150 endowed faculty positions.
Private funding has been critically important to respond quickly to some of the emergent public health issues. I'm really grateful for the funding that I have from the Edward E. and Helen T. Bartlett Foundation, because I have quite a bit of flexibility on how to use those funds.
All of those chairs are in support of the research mission of each of those individual faculty members, so the impact is profound.
We treat individuals with serious mental illness and will assist them with whatever they need, so medication management, case management. Part of our criteria is individuals who are at risk for homelessness, have had involvement in the criminal justice system or co-occurring substance use disorders, and we provide wraparound services to those individuals.
We've had obviously the support from the Oxley Foundation, but even other foundations have expressed interest in working on the problems we have in Tulsa, providing services for these kiddos.
Frequently, mental health is on the top of state funding where they're going to cut. Being able to have private funding to subsidize my portion of what I'm doing allows me to continue to provide high-level services to our individuals.
It's allowed me the freedom to be able to develop a program that was strong, that we could attract people to enter and come to Oklahoma.
One of the greatest achievements that we've had is building a research institution that is worthy of its national reputation. And I think the past 2 years has proven to us that not only do we need research dollars to support science, specific health protocols, but we need research to help support better public policy.
When I worked in applied public health, say for the CDC, we oftentimes didn't have the resources to learn as much from that situation as we would have liked to, just because resources were so thin.
And COVID is a perfect example where we really, as a society, had to develop a strategy to attack this virus.
In contrast, that's what academics do really well, is they collect data and they investigate and they learn from it. Also just realizing that when we're able to have the flexibility that, again, that often comes with some private funding, to then respond to what's the question right now.
We're making our mark as an institution in the application of that research and in translational research that goes very quickly to impact into our community and in many cases communities across the United States.
I realized over the course of my research career that what I really need is help in just building a team, because I was devoting so much of my time doing some bureaucratic work. It frees up my time to respond to some of the urgent calls or questions that I get, urgent meetings, but also it leverages the ability to apply for that correct mix of both private and public funding.
And maybe these days even more important is how that money gets leveraged so that when they arrive at our door, they have the necessary tools and equipment and personnel to support their research.